Today we're going to talk about Introduction to Drugs. This is in your Karches Focus on Pharmacology book. When we look at this chapter, this is going to give us a basic introduction to pharmacology itself and give a little bit of history of how drugs are made, how they pass through regulations, and how they're important for our nursing practice. So for our learning objectives, we want to talk about the definition of pharmacology and why it's important in nursing practice, describe the key categories of drugs and their sources, discuss the steps in the drug approval process, understand key terms such as generic, brand, and chemical names of drugs, and then explain drug classifications and scheduled drug classifications. So why do we want to understand pharmacology? So we want to understand the basics of pharmacology because we want to understand how drugs are going to interact with the body to treat, prevent, or even diagnose diseases. The definition of pharmacology itself is study of drugs and their effects on the body. And as nurses, this is important because we want to make sure we are safely administering medications, that we understand the therapeutic effects of the medication, monitoring for side effects because many drugs have adverse side effects, and educating patients on what the drugs are, how to correctly take them, if there's any regulations as far as if they can't take it with food on their stomach or they must take it with food on their stomach, if there's certain foods they need to avoid. These are all things we need to know and educate our patients about. So when we are doing education and learning about pharmacology, it's important to understand drug classifications. So there is therapeutic classification of a drug, and that is where we have a desired beneficial effect of the drug. Therapeutic classes are based on the disease or the pathology a drug is used to treat, and drugs can actually have multiple therapeutic classes if they treat multiple conditions. And then our pharmacologic classification is based on mechanism of action. So this is how the drugs work in our body. And drugs also can have multiple pharmacologic classes. And then a big one we need to understand as nurses to educate our patients is adverse effects. And these are the undesired or potentially harmful effects, also known as side effects. So where do we get drugs? Where are sources of drugs? So we can get them from natural sources, so such as plants, and this can be anything from opium for certain medications, from poppy seeds, or even foxglove digitalis, so digoxin that you guys will learn about next semester to help with the heart, and AFib. That is one that is derived from plants. Then we have animals. An example of this would be insulin. So insulin can be derived from pigs. And then minerals or inorganic compounds. And a big one you guys will see in practice in everyday life is iron. So iron supplements, people that have low iron. And then there's also synthetic sources. So these are where we have laboratory created drugs for greater purity and consistency. And a synthetic source drug example would be aspirin. So when learning drug names, we have a chemical name of a drug. So that chemical name is going to describe the molecular structure. An example of this would be acetylsalicylic acid. The generic name, so the official non-proprietary name, aspirin. And then our brand name, so it's trademarked by the manufacturers. So say Bayer's aspirin. So the chemical name of aspirin is acetylsalicylic acid, your generic name, aspirin, and it's trademarked by Bayer. This is a duplicate slide, so I'm going to just skip over that. Now we have our scheduled drugs. So these are our scheduled drugs that are often called also controlled substances. So I put a chart here for you guys to kind of look at so you can see what these schedules are. So controlled substance schedules 1 through 4. So schedule 1 is going to be a very high abuse potential. So we don't really have a medical use for it. And this is going to be something like ecstasy, heroin, LSD, marijuana, although there are some studies and things that are happening to try to have marijuana legalized in more places. Your schedule 2 through 4, so that's going to have decreased abuse potential and increasing medical uses. So you see on our chart, we have schedule 2, high potential for abuse, so morphine or oxycodone, methamphetamine. Schedule 3, we have less potential of abuse than class 2 and accepted medical use, so anabolic steroids or hydrocodone. Less potential than category 3, Valium, Xanax, Darvon. I don't even think they have Darvon anymore. Phentermine. And then your least potential for abuse, so cough medications that have codeine in them. An important thing to remember as a nurse is you want to monitor the administration and storage of these medications. You have to be careful when you document. So when you're giving these meds, you always are going to count how many were in there, how many you pull out, and how many are left. And then also for patients that, if you go on and work in a pain management clinic, it's where they do, drug tests and counting of the medications and things like that. And then you want to educate patients on misuse risk, especially if they're going to be put on something like a pain medication that's going to decrease their respiratory drive, or Xanax, as that's going to make them very drowsy. You want to make sure they understand the risk for abuse and misuse. So now we're going to talk about the drug approval process. I'm not going to spend a lot of time on this because your book gives you a really good picture, but essentially, for any drug in America, the FDA makes them go through a drug approval process. So our preclinical trials are going to be before they are tried on any human. So it's where they try things on lab rats or rabbits or things like that to see if they have any toxicity and efficacy to even go to the next step. So once they do, they are then classified into that phase 1 study. So they're going to test this on a small group of healthy human volunteers. Then our phase 2 study, we're going to have trials with patients who have the condition the drug aims to treat. Phase 3, we're going to have a widespread testing in clinical settings with a larger patient group. And then phase 4 studies is post-marketing surveillance to monitor those long-term effects. And then a little bit more about phase 4 clinical trials and off-label use. So with phase 4 clinical studies, the FDA has labeled a refined based on post-marketing surveillance. So that's looking at long-term effects and then also looking at approved uses, the risk and the benefits. And it's also going to help, it's going to include details on absorption, distribution, metabolism of the drug, and how the drug is excreted. So when we look at off-label use, so this is what these drugs can work for others that doesn't have has a label for that use. So technically this medication can be prescribed for one thing, but it also can help for another disease process. So this is common in pediatrics and geriatric populations. Nurses must understand liability, intended use, and potential problems. So if that patient was to be tried on the off-label use of a medication and something bad happened, there could be some liability and legalities in that. And widespread practice, often leading to new therapeutic discoveries. So a lot of times if this is being done and they're prescribed for a long term and we see good benefits, they may potentially go from off-label use to a on-label use for that medication. Drug safety during pregnancy is also important. As part of a standard and safety of FDA, it requires that each drug have a pregnancy category, and category indication drugs categories indicate drugs' potential or actual teratogenic effects. So you have category A, B, C, and D, and then category X. So category X is the worst. So studies in animals and humans demonstrate fetal abnormalities and adverse effects. A big one for this is the medication that people take for acne. That's prescription. It is known to have severe teratogenic effects. Oftentimes they have to take pregnancy tests during getting this, sign a contract that they'll be on birth control or that they will remain without child throughout the treatment process. And a good thing to remember is regardless of the designated pregnancy category or presumed safety, we really don't want to give drugs unless it is very much needed, just because there's always risk with any type of medication in the fetus. So nursing considerations and pharmacology. So understanding the pharmacokinetics of medication, so how that drug is absorbed in our body, how it distributes, how it's metabolized, and how it's excreted. You want to monitor for the therapeutic effects or adverse effects. Educating patients about those prescribed medications, and then our ethical considerations and patient rights when medications are given and prescribed. Key terminology to remember is pharmacodynamics, so what the drug does to the body, pharmacokinetics, what the body does to the drug, bioavailability, that is basically the percentage of the drug that reaches systemic circulation. And then another big term is first pass effect. So where this drug is metabolized before it reaches systemic circulation. So you'll hear us talk about first pass effect. So if it's in the liver, if it's in the kidneys, where that takes place. More key terminology. So generic drugs. So generic drugs are essentially the bioequivalent to a brand name medication, meaning they will work the same in the body in the same way. So to remember this, they do have inactive ingredients that are not required to be the same. So due to this, generic drugs may not affect all individuals the same. So for example, I work at a practice where I treat primary care as an NP. I have some patients that are on thyroid medication. So there is Synthroid, which is the brand name, and then there is levothyroxine, which is the generic. Okay, so some patients have to have the brand name for it to work correctly. So when that is prescribed, you have to put no substitution for that patient because they are not going to get the same effect as other people would taking a generic. Orphan drugs are medications developed for rare conditions. They may not be profitable for companies, so they are developed, but they may not be picked up by a company because it's not going to make them enough money. Over-the-counter or OTC drugs. So these are medications that are available without prescription for self-treatment. So Tylenol, cough medications, ibuprofen. And one important thing to remember is when you are asking patients for a medication list, you want to make sure you ask for prescription and over-the-counter medications as well as vitamins, because they will sometimes not understand that they need to tell you a full list of everything they're taking. Then there's also behind-the-counter drugs, and these do not require a prescription, but must be kept in a secure location in a pharmacy. So Sudafed, that's a big one that is kept behind the pharmacy, we know, because people use that to make other bad things. So you have to show your driver's license. There's only a certain amount you can get at a time, but you don't have to have a prescription. All right, and this is references for this chapter, and that is chapter 1 in your book. And we will move on to the next chapter here shortly.